Had any one of us prophesied in 1915 what would come to pass here, he would have been told he was dreaming. How in the world did Marshfield Clinic, rising with its companions like a kindly giant over rural Wisconsin countryside, grow here to become so renowned? How indeed. Without the railroad coming through, there would be no Marshfield. The current site occupies no distinct natural advantage. It was the unique combination of personalities and opportunities that brought the town into existence. In 1890, few physicians in America actually had a medical degree. Most had just served an apprenticeship or had attended a few repetitive lectures. K.W. Doege was different. He had just completed his medical studies at Ohio's Western Reserve College, one of the best medical schools in the country. He was returning home to Thorpe, Wisconsin, trying to decide where to open his practice. A train conductor told him, "Here's a good place. Marshfield. It's all new, just been rebuilt. Had a big fire and they need a doctor. And they need a doctor who can speak German." The young doctor took the advice. Doege was a visionary. He envisioned an associated group of physicians who, in addition to being well-schooled in general medicine, would each pursue a specialty of choice. In April of 1916, Doege sent invitations to Marshfield physicians. 5 physicians responded favorably. In doing so, they created an uncommon, even unusual corporation. Each member was required to purchase 1 share of non-interest-bearing, non-transferable stock for $1,000. The doctors agreed among themselves that K.W. Doege would do general surgery and specialize in thyroid and gastrointestinal surgery. Victor Mason would do general surgery and specialize in orthopedic and brain surgery. H. Milby would specialize in internal medicine and discontinue performing surgery. Walter Sexton would do all the urology. William Hipke would specialize in diseases of the eye, ear, nose, and throat. Dr. Roy Potter would be a radiologist. Their common interest? They all wanted better medicine. Establishment of this private medical clinic as a corporation became unique in the annals of medical history. It was a radical move. Group practices, while not entirely unknown, were viewed with suspicion, especially by the medical community. The State Medical Society condemned the group as being medical Soviets. Dr. Karl H. Doege returned from World War I and joined his father at the clinic in 1919. The clinic prospered in the 1920s, building a state-of-the-art building and adding 3 more doctors, the Vetter brothers and Dr. Lyman Copps. By the late 1940s, the clinic and its reputation were growing. Over 18 doctors were part of the clinic. Because of their size, they were able to recruit the top physicians of the era, as well as afford the latest in medical equipment. With the increase in size came new ideas for improvements in medical care, a laboratory, a research foundation, and a rise to national leadership in rural health delivery. By 1953, the clinic had 23 physicians. 2 of these physicians, Ben Lawton and Russ Lewis, along with Congressman Melvin Laird, propelled the clinic through the next 25 years with accelerated growth and building programs. Ben Lawton was a thoracic surgeon who was a strong proponent of group practice. Growing up during the Depression in rural Wisconsin, Dr. Lawton learned the importance of hard work, education, and commitment. Values that stayed with him as he became a physician leader at the Marshfield Clinic. As clinic president, he worked closely with 7 district congressmen and Marshfield native Melvin Laird in securing numerous National Institutes of Health grants for the recently established Clinic Research Foundation. Through Dr. Lawton's leadership and group practice foresight and its commitment to education, helped build the clinic's reputation as a national healthcare leader. Dr. Russell Lewis, a Marshfield native, an obstetrician and clinic president in the 1960s, realized that although Marshfield Clinic was an excellent medical center, many people in central Wisconsin could not afford to take advantage of that excellence. Working with Congressman Melvin Laird and officials at Blue Cross of Wisconsin, Marshfield Clinic founded the Greater Marshfield Community Health Plan. The clinic health plan offered complete medical care for 1 monthly premium. It became the first rural HMO in America. By the early 1970s, space was at a premium in the clinic buildings, and likewise at St. Joseph's Hospital. Working with the hospital, Ben Lawton and other clinic leaders drew up plans for a state-of-the-art clinic building adjacent to the new proposed St. Joseph's Hospital Tower. In 1975, the move to the present location was completed. Since that time, 8 major building projects have transfigured the simple 6-physician group practice to its current size. Also in the 1970s, the community of Mosinee lost their only physician. After unsuccessfully attempting to recruit a new physician, the community leaders came to Marshfield Clinic for assistance. The clinic was able to recruit a family care physician and thus opened the first permanently staffed regional clinic. It was a milestone, as the regional clinic system has now grown to provide primary and specialty care in many communities throughout northern and central Wisconsin. By the turn of the century, Marshfield Clinic had grown into an internationally known tertiary care integrated healthcare operation. The same quality of seamless care is provided in the smallest single provider regional centers as it is in Marshfield. One-stop shopping for healthcare, from well baby checks to the latest in diagnostic imaging and neurosurgery. And it's all made possible by electronic medical records, which are accessible at all locations with diagnostic decision-making support. Although much has changed outwardly at Marshfield Clinic, one thing is not: the philosophy upon which the clinic was founded, that education and specialization provides better medicine and offers patients the best possible care. And for over 90 years, Marshfield Clinic has done just that.